Hi, I'm Dr. Baluja, and today we're going to talk about the different kinds of pain. Basically, we have two different groups. We have this group called the nociceptive pain and this group called the neuropathic pain. So, nociceptive pain is thought of somatic, which is bones, joints, connective tissues, and muscles, and then visceral, which is the organs, heart, liver, pancreas, gut, and all of that. So, basically, nociceptive pain, the term nociceptor are basically nerves which sense and respond to parts of the body which suffer from damage. Keyword being damage. They signal tissue irritation, they have impending injury or actual injury, and when activated, they transmit pain signals via the peripheral nerves and as well as the spinal cord to the brain. The pain is typically well localized and it's constant, and it's often aching or throbbing in quality. Visceral pain, on the other hand, is a subtype of nociceptive pain that involves internal organs like we talked about, organs like the heart, the liver, the pancreas, and the gut. It tends to be episodic and poorly localized. Nociceptive pain is usually time limited, and meaning when the tissue damage heals, the pain typically resolves. Arthritis is a noticeable exception in that it's basically not time limited. Another characteristic of nociceptive pain is that it tends to respond well to treatment with opioids, whereas neuropathic pain does not. So now let's go to neuropathic pain. We've talked about the nociceptive pain. Let's talk about neuropathic pain. So examples include post-herpetic neuralgia, shingles, reflex sympathetic dystrophy, causalgia. We talked about causalgia in another video. Components of cancer pain, phantom limb pain, entrapment neuropathy, carpal tunnel syndrome, peripheral neuropathy, and among the many causes of peripheral neuropathy, diabetes is basically the most common. The condition can also be caused by chronic alcohol exposure or exposure to other toxins. You can have vitamin deficiencies, and basically a large variety of other conditions can take place. So basically it's not unusual for the cause of the condition to go undiagnosed in nociceptive or in neuropathic pain. So we've talked about nociceptive, we talked about neuropathic pain, and so you could have deafferentiation, and that's really where you have sort of a phantom limb pain. You have a sympathetic maintained pain, and you can have a peripheral neuropathy, diabetes, like we talked about. So neuropathic pain it's chronic, and it tends to have a less robust response to treatment with opioids, like we said before. It can respond well to gabapentin and other anti-seizure drugs, carbamazepine, Tegretol, carbamazepine or Tegretol, which is the same thing. And it can also respond to antidepressant medications. So usually neuropathic problems are not fully reversible, but partial improvement is often possible with proper treatment. There's another category called basically a mixed category type of pain. In some conditions, the pain appears to be caused by a complex mixture of nociceptive, and if you go back to think about nociceptive tissue damage, and then some are neuropathic factors. So an initial nervous system dysfunction or injury may trigger neural release of inflammatory mediators, and that causes subsequent neurogenic inflammation. For example, migraine headaches probably represent a mixture of both neuropathic and nociceptive pain. Myofascial pain is also probably secondary to nociceptive input from the muscles due to tissue damage, but then abnormal muscle activity may result in the neuropathic conditions. So basically we've talked about two different types of pain. We've talked about nociceptive, and the nociceptive includes sprain, bone fractures, etc. We talked about this. We also talked about the visceral and the somatic in the nociceptive, and tissue damage is really the issue with nociceptive pain. In neuropathic pain, you have examples such as reflex sympathetic dystrophy, causalgia, nerve trauma, components of cancer pain, phantom limb pain, and so these basically they're a result of injury or malfunction to the peripheral or central nervous system. So notice how nociceptive pain is a result of tissue injury, and neuropathic pain is a result of nerve injury. So that's basically the understanding. Nociceptive, tissue, neuropathic, nerve. So that's the end of this video. Please visit us at www.askpaindoc.com. That's www.askpaindoc.com.